Hello guys, my name is Faith Tukombe. Welcome back to my YouTube channel, and today we are in an exciting field of kinesiology. So we are going to look at the sternoclavicular joint. The sternoclavicular joint is a joint that is made up of the sternum and the clavicle. The sternum part, the manubrium part of the sternum, and the medial aspect of the clavicle. So as we can see, this is the clavicle, the medial side of the clavicle, and the manubrium of the sternum. So between the manubrium and the clavicle is the sternoclavicular joint, which is now having the sternoclavicular disc in between. So around these articular facets, we have ligaments as the costoclavicular ligament, sternoclavicular ligament, and the interclavicular ligament, which intersects from this part to the other clavicle. So the movements that occur on the sternoclavicular joint are on the basis of the sternoclavicular disc. So what happens? We have motions such as protraction, retraction, elevation, depression, and anterior posterior rotation. So during protraction and retraction, the movement occurs in the vertical axis. So during the vertical axis, the sternoclavicular disc becomes one with the clavicle. It becomes one joint with the clavicle. So the sternoclavicular disc and the clavicle, the medial aspect of the clavicle, move on the manubrium facet to produce the motion of protraction and retraction. So protraction, the medial aspect of the clavicle goes anteriorly, goes posteriorly, and the lateral aspect comes anteriorly. During retraction, the medial aspect comes anteriorly, and the lateral and the lateral aspect of the clavicle goes what? Posteriorly. And this happens at the degrees of 15 to 20 degrees. So 15 to 20 degrees for protraction and 20 to 30 degrees for what? For retraction. So retraction, the lateral aspect comes anteriorly, and the medial aspect of the clavicle goes what? Posteriorly. Then we have other movements, which is elevation and depression. During elevation and depression, the manubrium becomes one with the sternoclavicular disc. So the clavicle now moves on the manubrium, where the sternoclavicular disc and the manubrium are one joint. So elevation, when there's elevation, the clavicle rose on the manubrium facet and sternoclavicular disc going downwards, and then during depression, the clavicle moves upwards, superiorly. It moves superiorly, and the lateral aspect moves downwards, whilst on the medial aspect it moves superiorly. And during elevation, it is the opposite, downwards. Elevation, the medial side goes downwards, and the lateral side goes upwards. So elevation occurs at 48 degrees, and depression occurs at 15 degrees. Then we have the anterior-posterior rotation. Anterior-posterior rotation occurs on the spin, as a spin. So the clavicle is like a spin in between the facet, the manubrium facet, and the sternoclavicular disc. So it is like a spin. It spins. The rotation is spinning anterior-posterior and spinning again outward. So this occurs along the longitudinal axis. So there's what we call the sternoclavicular stress tolerance. This stress tolerance, the sternoclavicular does not undergo degenerative procedures. Why? Because of the sternoclavicular disc. And also the ligaments around the joint also help in maintaining it and producing stability, as well as absorbing the forces that come against it. Thank you very much. This is Faith Tukombe. See you next time. Bye bye. Oh,